Okay, so first we're gonna start with your head. Your hair looks fine. Do you have any tenderness in your head? No balding, no lesions, no dandruff, all looks good. No lesions, lumps, the shape and contour is fine. So your facial expressions, can you smile for me? It's all symmetric, no masses or edema. So your skin, the color is normal for race and gender and age. The texture is fine, no dryness. Your facial hair is evenly distributed. Do you have any scars, bruises, lesions anywhere? Okay. So for the eye exam, I'm gonna wiggle my fingers behind you and you're gonna tell me when you can see them, okay?
No. No.
Okay. So the kinetic red test, you're gonna tell me when you can see my finger in your visual fields, okay? And I would use a light for this, but I don't have it.
No. No.
Okay. So eyebrows are symmetrical, your eyelids as well. The color is normal, no swelling. Your eyelashes are appropriate and going in the right direction. No excessive tearing of your eyes, and that's well lubricated. So now I'm gonna push down on your eyes and I want you to try to look up. Good, any pain with that?
Nope.
Now I'm gonna have you look to the sides and look up and down. Perfect. No nodules, and the sclera the color is appropriate. Now, if I had a light, I would just have you look straight and look at it. Okay, everything is normal there. The iris is clearly marked and well defined. There's no shadow, so no glaucoma noted. Your pupils are symmetrical and normal, and then I measure your pupils and they're about 3 to 4 millimeters apart. And then with my pen light, I would dim the lights, and then with my pen light, I would shine in look straight ahead for me, shine it in your eyes, and your pupils are equally reactive to light. And then I'm gonna have you follow the tip of my pen finger and towards your nose, and they're reactive to accommodation as well. For your ear exam, any tenderness here?
Nope.
No lesions, no deformities, and they're symmetrical. I'm gonna do the tug test. Any tenderness?
No.
Any tenderness here?
No.
Okay. Now I'm gonna use my pen light to look inside your ears. Everything's normal, and your tympanic membrane is pearly gray. So the whisper test, I'm gonna have you turn that way, whisper in your ear. 3 letters and 3 numbers. I want you to let me know what you're saying, what I'm saying, okay?
ABC 1, 2, 3. ABC 4, 5, 6.
Perfect. And then with the tuning fork, we do the Weber and the Rhine test. So I would strike the tuning fork, put it on top of your head, and you would tell me if you can hear it equally in both of your ears or if one was louder. And then I would strike it again, put it behind your ear. You would tell me when you would stop hearing it, and I would put it in front of your ear, and then do the other side. Now I'm gonna do your nose. It's symmetrical, no lesions, any obstructions, okay? I'm gonna hold one nostril, breathe in and out, good, good. So I'm gonna look up your nose at the pen light. Mucosa is nice and pink and moist, no swelling or drainage. I'm gonna palpate your sinuses here. Any tenderness?
Nope.
Okay. So now your mouth and throat, you have your own teeth. I'm gonna put my gloves on, have you open your mouth wide and say ah.
Ah.
Perfect. Look at your lips, nice and pink. Your oral mucosa is nice and moist as well. Can you open your mouth for me? Look at your gums. Perfect. Any tenderness? Okay, and your gums are pink. Then I would use the tongue depressor, have you say ah. Notice that your soft palate is rising. And also with that, I noticed no redness, no exudates or ulcerations on the pharynx. So neck exam, everything is symmetrical, no lesions, bruises, no trauma to the neck.
Nope.
Okay, no tenderness.
Nope.
Okay, there's no large enlargement. I'm gonna palpate the lymph nodes here. Any pain while doing this?
Nope.
Down on the clock. scars there. Let's see, and behind the ears there was no tenderness as well?
No.
Okay, so your trachea is midline. Have you swallow for me? Okay, and tilt back and I'll give you a drink of water and watch you swallow as well. Okay, it's midline, no deviations. When I palpate, do you have any discomfort?
No.
Perfect. So I'm gonna listen if I have my stethoscope while you take a deep breath. Okay. Okay. I can hear the tracheal breath sounds. Now, while you tilt your head back and take a sip of water, I'm just looking at your thyroid glands. Okay. Now I'm gonna have you do that again, and while you swallow, I'm gonna feel. Okay. Any tenderness?
Nope.
Perfect. Okay, so now for the reflexes, we're going to start with the bicep, and I would use a hammer here. So just go ahead and relax. Perfect. Do the other side. Okay, now for the tricep, I'm going to have you hang your arm like this, and just go ahead and let me hold it. Okay. Over here as well. Perfect. And then the brachioradialis. Hammer there. There. And now the knees. So just go ahead and relax your knee for me with the hammer. Okay. Perfect. And then we would do the Achilles. Okay. And then this plantar response, it might be a little ticklish. Perfect. Okay. So now we're going to do the sensory exam. So I'll have you close your eyes and you're going to tell me the difference between sharp and dull, okay? So this is dull, this is sharp, okay?
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Perfect. Now, warm and cold. This isn't very warm, but this is cold. This is warm, okay?
Cold. Warm. Warm. Cold.
Great job. Okay, so now with your eyes closed, I would use my tuning fork again and place it on your hand. You would tell me if you can feel that.
Yep.
Okay. Do this again.
Yes.
Perfect. So I'm going to be moving your big toe in different directions with your eyes closed. Tell me which direction.
Up. Down. Up. Down.
Okay.
Up. Down. Up. Down.
And for the thumbs.
Up. Down. Down. Up. Up. Down. Up. Down.
Okay, I'm going to put an object in your hand with your eyes closed and you're going to tell me what it is.
A Q-tip.
And this one.
A cotton ball.
Perfect. Okay, so now I'm going to draw a number in the palm of your hand and you're going to guess what it is.
3. 7.
Great. Okay, so now I'm going to touch the tip of your fingers with your eyes closed. You're going to tell me if you feel 2 or 1 touch.
2. 1. 2. 1. 2.
Perfect. So now with your eyes closed, I'm going to touch you randomly throughout your body and you're going to touch where I touched, okay?
Okay.
Okay. Now I'm going to do the same thing. You're going to tell me if you feel 1 touch or 2 touches.
1. 2. 1. 2.
Great. Now we're going to do the cranial nerves. So for the olfactory nerve, I'm going to have you close your eyes and plug one nostril. Tell me what you smell.
A candle.
Okay, do the other side.
Cinnamon.
Perfect. Cinnamon candle. For the optic nerve, I'm going to have you read the smallest line you can here.
Nicholas Allen Howell.
Okay, now cover one eye and do it again.
Nicholas Allen Howell. 1, 2.
And the other line, or the other eye.
Nicholas Allen. 1, 2, 3.
Perfect. So 20/20 vision in all eyes. Okay, so now for the oculomotor nerve, if you would follow this, Follow my pen light into your eyes. Great, deeply reactive. Now look at the top of my pen light, or the top of my pencil here, and then look to that object back there.
Okay.
Here, there. Perfect. And they're equally reactive to accommodation as well. So now you're gonna follow for the trochlear nerve, follow my pencil in a T form. Great. So for the trigeminal nerves, I'm gonna have you look up. I'm gonna touch my cotton ball. And blink. And blink. Perfect. So now I'm gonna have you close your eyes and I'm gonna touch an object to your forehead and you're gonna tell me when you feel it.
Now. 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 Now.
Okay. So sharp and dull. Tell me which.
Sharp. Dull. Dull. Sharp.
Perfect. Cardinal directions, we already checked those. And the facial nerves, I will have you show me your teeth. Smile. Frown. Okay. And then raise your eyebrows. Puff out your cheeks. Okay. And close your eyes, and I want you not to let me open them. And then tense your neck muscles. Perfect. So cranial nerve number 8 was the whisper test. We already did that, and it was perfectly fine. And then the tuning fork test, we already did that, and it was normal. So glossopharyngeal nerve, I'm gonna have you stick out your tongue and say ah.
Ah.
I would put the tongue depressor on your tongue, make a stimulated gag reflex, have you swallow water, and then say your name.
Nicholas Allen.
Okay, no hoarseness noted. For the accessory nerves, I'm gonna place my hands on your shoulders and have you shrug. Perfect. Any pain there?
No.
Okay. So now I'm gonna have you turn your head against my hand. Perfect. Now stick your tongue out straight, move it side to side. Awesome. And that's that. So for the musculoskeletal system, your jaw, no deformities. Can you open your mouth wide and move your jaw side to side? Awesome. Let's see. So for the shoulders, I would do this in a patient with their shirt off if possible. So I'm just gonna palpate along the clavicle here, and scapula back here. Any pain back here?
No.
Okay, so I'm gonna have you raise one arm above the head, and down, next arm, okay, and down. Any pain?
No.
Okay, so now I'm gonna have you stand up, extend one arm behind you, next arm. Any pain there?
No.
Perfect. Now I'm going to have you put one of your arm, abduct one of your arm, and then over your head. Okay, another arm. There we go. Any pain?
No.
Okay, so now I'm gonna have you put your right arm straight out to the side, bend your elbow. Any pain?
No.
Do the other side. Okay, so now I'm gonna have you arm straight down, one arm out. Okay, now reach to your shoulder, over the other one. Then you're gonna reach back behind you to the opposite shoulder.
Okay.
Any pain with that?
No.
Okay. So take one arm straight out and move it all the way across your body, and then do the other arm. Any pain with that?
No.
Okay, so we're gonna test your rotator cuff. So we're gonna bring your arms to 60 degrees, 90 degrees, 120, 180, and then slowly back down. Perfect. Any pain or discomfort with that?
No.
Okay, so I'm gonna, while you raise your arm up, I'm gonna place my arm on your shoulder here. No clicking or popping noted. And do this one over here. Okay. So now I'm gonna have you put one arm to the side, bend at a 90-degree angle, and then bend it in and down. Any pain?
No.
Okay. Do the other one. Okay. And then for the sits muscles, put your arms straight out in front of you. Rotate them in. And now try to straighten them and bring them back around while I put pressure on them. Any pain?
No.
Okay. Now for forearm supination test, put your arms straight and put your hands like you're holding a bowl. Now you're gonna try to flip them over while I put pressure on them, okay? Put them. Okay. So you're gonna stand straight. You're gonna put one arm out and let it drop slowly to the side. fixed arm? Any pain with that?
No.
Okay, I'll have you sit down now. And I'm just gonna feel your elbow for any tenderness. Any tenderness?
No.
Feel this one. And no effusion on that one or the other one. Okay, so we're gonna test the range of motion on your elbows. I'm just gonna hold it. Let's bend it up here. Okay, so I'm gonna have you put your hands out like this. We're gonna test pronation and supination. So
Okay.
Perfect. Any issues with that?
No.
Okay, so for your wrists and hands, I'm just gonna feel them. Any pain or tenderness in your fingers or wrists?
No.
Okay, so have you flex them, and I'm gonna feel all of your bones. And I'm gonna feel all of your joints as well. No swelling noted. No pain or tenderness.
Mm-mm.
Okay, so now how you put your palms facing the floor, raise your fingers up to the sky as high as you can, and then down to the floor as far as you can. And then you're going to move your fingers in and fingers out for adduction and abduction. So we're going to test your strength. So squeeze my fingers and do not let me pull them out. Okay. So now you're going to grip your thumb with all of your fingers and move your wrist in towards yourself. Any pain?
No.
Okay. So palm facing up. I'm going to put some pressure on your thumb, and you're going to try to raise it up. Any pain?
No.
And this one?
No.
Now you're going to take your thumb and touch the base of your pinky. And then show me this way. Okay, each one. Perfect. Now you're going to put your hands in front of you with your palms facing up. Touch each thumb, or your thumb to each tip of your finger. Okay. You're going to put your hands back to back and with the elbows up, and we're going to hold for approximately 30 seconds. Any pain?
No.
And numbness or tingling? Okay. You can go ahead and put it down. So I'm going to have you go ahead and stand up. I would usually do this with a shirt off and turn around here. I'm just checking the concavement of your back. And palpating down your vertebra. Any pain?
Mm-mm.
And palpating the muscles of your back. Okay, good. Okay, so I'm gonna have you lay flat right there on the table there and roll over to your left side. Okay, and keep this bottom leg straight. And just any tenderness down here. Okay, perfect. You can come back over here and sit up. Now I'm gonna have you, we're just gonna assess your range of motion. Put your chin to your chest and head back and look up to the sky. And then look over your left shoulder and your right shoulder. Okay. Now we're gonna test the range of motion of your lower spine. So if you could stand up, I'll have you bend over and try to touch your toes. Any pain with that?
Mm-mm.
Okay. Now, I'm going to support your lower back while you try to bend backwards. Okay, that's good. Any pain?
Mm-mm.
Okay. Now, rotate your upper body from side to side. Any pain?
Mm-mm.
And bend side to side with your arms down. Any pain there?
Mm-mm.
Perfect.
No.
So now while you're walking across the room here, I'm assessing your hips, the stance, and your gait. Okay, you can come back. Okay, so now you can lay on your back. And we're going to check the flexion of your hips. So I'm going to have you bring your knee to your chest and hug it. Perfect. And then do the other one. Okay, so now I'm going to have you move this like off over here and just strap it down. Any issues with that?
No.
Okay, and then I would do the other side. So then we would test adduction and abduction. So any pain?
Mm-mm.
Perfect. leg up and twist your ankle around here. Okay, good. You can sit back up. Now we're going to do the knee exam. I'm just going to palpate them for any tenderness.
No.
No swelling. I'm going to have you straighten your leg out and then bend it back and then do the other leg. Perfect. Now I'll have you swing one leg towards your midline. Okay, and the other one. Any pain?
No.
Okay, so now you can lay back down. Okay, so now we are going to test your ACL. The anterior joint test. I'm going to support your foot here, put my fingers behind your knee, and pull forward. Any pain with that? Okay, that's normal. And do this one. And we're going to do the posterior jaw, which is the opposite. I'll put my fingers behind your knee and push backwards. Any pain with this? Okay, that's normal. And then for this, I'm just going to hold your knee here. And move your feet out. Any pain? And then we'll do this side if I was over there. Any pain? Okay. Okay, so you can sit back up and we're going to do your feet and ankles. Okay, so I'm going to use my thumb to feel your heel. No fogginess or tenderness. Any tenderness in the Achilles tendon back here? Okay. What about this one? Perfect. I'm just going to feel your bones here. This one as well. Now I'm going to have you point your toes up to the ceiling as far as you can, and then all the way down as far as you can. Now I'm going to stabilize your heel and move your top of your foot around, in and out. Any pain?
No.
And this one. Any pain?
No.
And then I'm going to do it in the opposite. Any pain here?
No.
And any pain here?
No.
Okay, so I'm going to wiggle each of your toes, make sure the range of motion is okay. Any pain or tenderness?
No. No pain.
Okay, so now we're going to do the muscle strength test. So let's just try and move your shoulder around here. Any pain?
No.
Perfect. Any pain?
No.
Okay, so your legs and neck's a little bit hard here, but any issues there? Okay, so I'm going to have you put your hands up. Remember, pull against me and then push against me. Awesome. Now I'm going to make a fist and push down against me. And push up. Okay. Now we already did the finger muscle strength test there. Now touch your thumb to your finger, and I don't want you to let me pull them apart. Great. So now I'm going to have you lay back again. We're going to test flexion of the hips. So try to push your leg up while I put slight pressure on it. Okay, and this one. Great. So now try to push your leg down while I pull up. Perfect. Perfect. Okay, so for abduction and adduction, I'm going to be pushing and you're going to try to push the opposite direction, okay? Okay. Okay, so if you want to put your knee up here, I want you to try to straighten your knee against me. Okay. Perfect. So for dorsiflexion, pull your toes against me. And this one. Okay, have you sit back up. Giving you a good exercise. Now I'm going to have you chest coordination, so put your palms in the back of your hands, tap them back and forth on your feet. Good. Now, we already did the thumb to each tip of your finger. So you're going to touch my finger now. So we're going to assess point-to-point movements. Touch my finger and then touch your nose. Okay. Now with your eyes closed, you're going to touch my finger and then point above your head, okay?
Okay.
Okay, good. Okay, so now you are going to take your left heel, put it underneath your right shin and go all the way down. And the opposite side, any issues there?
No.
Okay. Now I'm gonna have you stand up and walk across the room. Okay, and walk back on your tippy toes. And then walk back again on your heels. And then you can walk back normally. Perfect. Now I'm gonna have you hop on one leg. And then hop on the other leg. Great. Now do a shallow knee bend. And then on one leg and on the other leg. Okay, so for the Romberg test, I'll have you stand with your eyes closed while I look for swaying and the ability to remain in upright position. Perfect. Now with your eyes open, you're going to put your arms straight out in front of you with your eyes. And then with your eyes closed, put your arms straight out. And then close your eyes. And then you do that for 20 to 30 seconds. And then if I push down, your arm should go right back up. Perfect. Okay, so for the thorax and lung, again, you can go ahead and sit back down. We would take the shirt off if possible. No surgical trauma, scars, or anything. I'm gonna make sure this is still recording. Okay. No bruising, lesions, issues there. Okay. So no barrel chest. I can tell that you're not having any difficulty breathing, correct? No intercostal retractions or paradoxical movements since you're not having any trouble breathing. No hypertrophy or muscle wasting present, and no cyanosis present or blueness on your fingers or your mouth. No wheezing or stridor because you're breathing perfectly fine. So I'm going to put my hands on your chest and just assess for symmetrical expansion. So take a deep breath in. Perfect, that is symmetrical. Now I'm going to palpate for tactile firmitus. So every time you feel me place my hand on you, you're going to say 99.
Okay, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect, so those are good vibrations, both. Now I'm going to percuss the front of your chest so you'll feel me tap a little bit. Some good resonance was felt, no dullness. So now I'm going to auscultate, and I forgot my stethoscope obviously, so each time you feel my stethoscope, you'll take a big deep breath in. Perfect, your lungs were clear. Now we're going to move to your back. If you want to turn around for me. So your back. Okay, so no kyphosis or scoliosis, no lesions, no trauma, no issues with your back, no bruising, lesions, anything, no deformities. So I'm going to do the tactile firmitus again. So when you feel my hand, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect, good vibrations were felt as well. Now I'm going to percuss again with the tapping. Perfect, good resonance was felt. So now I am going to have you take a deep breath in and hold it, and I'm going to palpate down your back, okay? Okay, you can let it out. And now you're going to do it again, and once you release your breath, I'm going to palpate again, okay? And let it out. Okay, now I measure that. And warm about 3 to 4 centimeters. Now, I'm just going to auscultate, so every time you feel me, you're going to just take a deep breath, okay?
Okay.
Okay, our lungs are clear. So now we're going to auscultate for bronchophony, egophony, and pectorallically. So for the first one, for bronchophony, when my stethoscope touches you, I'll have you say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. And then for whispered pictoriloquy, I'm gonna have you whisper 1, 2, 3 when my stethoscope touches you, okay? And the whispered sounds were faint, which is normal. And then lastly, for egophony, I'm gonna have you say the letter E when I place the stethoscope on you.
E, 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 E.
Perfect. So there was no E to A consolidation changes, and that's normal. Okay, so now I'm gonna have you lay down at a 45-degree angle. We're gonna do cardiovascular assessment. So I'm gonna test for the point of maximal impulse here and measure it. This intercostal space and here. Perfect. Now I'm gonna assess for JVP, so I can turn your head to the left and just assess for any pulsation. And then I'm gonna measure from the top of the pulsation point to the sternal angle. And normals are from about 4.5 to 5 centimeters. So now I'm gonna assess your carotid pulses one at a time here. Okay, other side. About 5 seconds each. And then we're gonna do your brachial pulses. Other side. Okay, and then I'm just gonna listen to your heart sounds. Great, those are all normal. And now I'm just gonna feel for any thrills or bruises while you breathe. None felt. So for the abdomen, the last thing I'm gonna do here, I'm just inspecting for any tenderness. Any tenderness here? Any trauma, scars, lesions, bruises, anything like that, okay? No protruding present, and there's no bruising or inflammation. So now I'm gonna listen over your aorta here, and then your arteries. And then we go down to your femoral arteries. Okay. And then I'm going to palpate your abdomen. So first lightly.
Sorry about that.
And then I'm going to do lightly and then deeply. So tell me if you have any tenderness. Okay, and then a little deeper. Any pain? Okay, so now I'm going to percuss the 4 quadrants here. Any pain there? Perfect. Are you having any pain anywhere at all? Okay, have your cough for me. Any pain with that? Okay, now I'm going to check for rebound tenderness here. So pressure here. Any pain? Okay, so Murphy's sign is a hook maneuver here underneath your ribs. Have you take a deep breath. Any pain there? Okay, that's negative. A Ropsing sign, I'm going to put left pressure in your left lower quadrant here. Any pressure or any pain?
Nope.
Okay, so now we're going to go down to your legs. I'm going to put pressure on them and you're going to try to lift them up. Any pain with that? Okay, so let's see with your leg. See if it's still recording. Okay. Have you bend your leg up and rotate it around and out? And with this one. Any pain with that?
Nope.
Okay. So now, any sensitivity of the skin at all?
No.
Okay, so now we're gonna palpate. I'm gonna palpate your liver here. And I'm gonna do the hook method again. So take a big deep breath in. And I was not able to palpate your liver, which is normal. So I'm gonna try to percuss. Perfect. Now we're going to percuss your spleen, which is over here. Any pain? Okay, I'm just gonna palpate it. Any pain? And I can't palpate it, which is normal. So now I'm gonna palpate your kidneys. Just underneath here. Any pain while I'm doing this?
Nope.
Any pain here? Okay. And I was not able to palpate them, which is normal as well. Let's see. So I'm gonna palpate the width of the aorta, so right above your umbilicus. Straight up. The normal is about 3 centimeters, and I'm gonna look for any pulsation. So the last thing here, I'll you sit up and I'm gonna assess for CVA tenderness. You're gonna just sit on the
Okay.
side. And I'm gonna tap pretty hard back here, and you'll tell me if you have any pain, okay?
Okay. Oh, yeah. No.
Over here.
No.
Perfect. That is all, okay?
Thank you.
Thank you. Have a wonderful day.
I will.
Evening.
You as well.